Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Pregnancy's done. What's safe in terms of lactation / breastfeeding, as well as what would your priority list be to get back onto, you're already beautiful. You want to be more beautiful after the babies come.
So my priority is going to be for myself. I'm going to re-Botox myself. I love to do some masseter Botox for grinding. And so that's something I definitely have been missing. I have gotten to do more expressive videos during my pregnancy because there's no Botox on board here. So I've been able to I'll be able to do some great demonstration Botox videos on how Botox works after this. But I'm excited to get back on board on that. And then I'm planning to do a deep resurfacing laser to just address pores, texture, tightening. And then I haven't been able to do much for pigmentary changes in my skin, a couple brown spots that popped up during pregnancy. So I'm excited to zap those into oblivion. And then any filler, I'm going to wait until my body normalizes, goes back to a closer to normal weight. A lot of that fluid retention that you have in pregnancy really can make you feel quite puffy. So I won't be jumping to redo any of that until I get a better sense of where my face is stabilized, just like we would say for any potential body surgery after pregnancy. I do intend to breastfeed. Botox and breastfeeding is another one of those topics that's officially taboo because, again, there's no study that has proven it, but I have a lot of female physician colleagues, including myself, that don't see why we couldn't Botox ourselves while pregnant. It's a microscopic amount of a neuromodulator that's injected into the face. So the concept of it migrating when we already don't think it migrates to begin with out of the areas of injection all the way to your bloodstream, all the way to your breast milk, and then what ultra microscopic concentration that potentially would go to a baby. It just seems far-fetched.
Yeah, we already know it doesn't really migrate because if you inject it into a muscle belly, that's the muscle that is weakened or has a hard time moving. It's not like you inject it in a tiny area in your forehead and suddenly it jumps into your, nose or scalp or anything like that.
Exactly. So what I tell patients is I can't promise you there's no data I can point to say that this is absolutely 100% safe. It's something I'm comfortable doing for myself. But if you're someone that needs absolutes on it, then best just to wait until you're done breastfeeding.
Yeah. And then there are, of course, a lot of medications generically that you should not take if you're breastfeeding. And in terms of deeper chemical peel or other chemicals that we use in aesthetics, I was wondering what your thoughts were in terms of what you're going to be starting up or not, since you'll be breastfeeding right after the baby's delivered.
Yeah, I'll still be avoiding chemical peels afterwards. Like I said, I think laser resurfacing, I'm quite happy to inject lidocaine for blocks on myself, and I'll do my normal topical numbing for that, and maybe wait to breastfeed until later in the day or when those have passed through my body. And that's pretty much it. I'm going to go back to my regular skincare regimen afterwards, and probably with more of a focus on evening pigments.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.